as a future doctor and as an informed citizen of this country in general, I do not agree at all with the NHI bill that has just been passed.
I believe that the NHI is going to be an absolute disaster in South Africa.
To me, it seems like the National Insurance Fund will not improve the quality of health for most South Africans, but instead it will burden them with higher taxes and lower incomes.
We are gathered here today to bear witness to the signing into law of the National Health Insurance Bill, which at the stroke of the pen is about to become an act of parliament.
Our hospitals in particular in public sector have become a fortress of death. As a healthcare worker who's doing bedside nursing, I've seen many patients who actually were not supposed to die, but we send them to the grave. Why? Because it's humanly impossible for us to save everyone, and that nonsense you'll never see in private sector. And then look at it. When I'm saying we have a CEO running a public hospital, you are the head of the institution, but when you are sick you go to private sector. We have a minister of health who goes to private when he is sick. We have the SOTs, we have all these people in positions of authority. That is why we believe it's the greatest equalizer. Why? It's going to force us to sing from the same hymn. When we defend the healthcare system, we are not going to say public sector is neglected. It's either public sector or private sector, whatever sector, healthcare sector in South Africa, we will be saying it's neglected and everyone will be affected.
We as an organization support the idea of universal healthcare. We think that it is one of the only ways to actually ensure equality in healthcare, to put everyone on an even footing as far as access to healthcare is concerned. However, the way that it's being implemented in the country, I think might be cause for concern. One thing that we've called for time and time again is the piloting of NHI, and particularly piloting in different districts in the country.
But what the NHI does, and in its different phases, it presents an opportunity to restructure how health is organized at the local level by changing the way that it's funded. So instead of sending money straight to a province and then the province sends the money to all the hospitals and the clinics in line with what they spent last year, I think with the introduction of the NHI, how that health is delivered changes. For rural areas, I think one of the things that we need to do and what the NHI allows for, in the first instance, is for more outreach. Right, so with ward-based outreach teams, right, being part of the funding cycle and being linked to particular clinics, we can actually go look out and promote healthcare services, which we don't do at the moment. Right, so people living in our community can talk to pregnant mothers, and many community health worker projects that are donor funded at the moment do that, where we encourage younger women to come into the health system more.
For any member of the community to go to a clinic, if they're not feeling well today, they must be prepared to spend the whole day in a clinic, or they must wake up around 1 o'clock a.m. and go to a clinic that opens at 7 a.m. Now, don't talk about the risks. You're not talking about the risks, of one's life, for one, because our communities are quite dangerous out there. But people have to wake up at 1 o'clock, even if it's raining, and brave the weather, and go to a clinic whose gate is closed, and only to queue there throughout the night for a clinic that opens at 7.
A country like South Africa, it's one of the top leading unequal country in the world, which means our health system itself, it's totally unequal. We've got a very rich private health system, which is against a poorly financed or resourced public health system. So an NHI will bring equity between the two health systems. Therefore, we want NHI which is going to bridge the gap between the two health systems.
As DENASA, we regard the national health insurance as one of the solutions to the current challenge that we are faced with. National health insurance is an insurance which will cover every South African in terms of their healthcare service needs, whether they are working or not working. To us, that on its own talks to the area of the principle of equity and equal access to quality health care or universal health coverage. We are sick and tired as nurses of taking care of patients that we know we are not taking care of comprehensively. The shortage of resources, the shortage of staff, the shortage of equipment is something that talks to that inequality. And nurses do not feel that they are actually giving out their all in terms of healthcare services to these patients.
We have to start reorganizing our health system towards the needs of the 80%, right? And use our money effectively, because I think the public health system is something that we need to protect.
We as an organization do believe that universal healthcare, the implementation of universal healthcare, is a step in the right direction.